meningitis scare at a Fort Wayne elementary school last month cost more than $18,000 when it was all said and done.
News Channel 15's Holly Campbell joins us now with who's paying for it, where that money's coming from, and what the health department learned from the experience.
That money helped cover staffing and medication for nearly 500 people. And the Allen County Health Department administrator says addressing the meningitis scare was one of the smoothest operations they have ever had.
December 11th, the health department has alerted someone at St. Joseph Central Elementary has been diagnosed with bacterial meningitis. Shortly after, a plan is in motion.
It was more about decision making, ensure that we don't leave folks out that might need the prophylaxis or to offer it to them, and we didn't want cost to be a barrier.
By December 15th, nearly 500 students and adults are treated with the medication prophylaxis. The whole ordeal cost Fort Wayne Community Schools nearly $3,000, Parkview Pharmacy about $900, and the health department more than $13 grand, totaling more than $18,000. But Administrator Mindy Waldron says that's actually a relatively low amount to spend on a response like this one.
Partially because this was a medication versus a vaccine, and vaccines generally more expensive, so we generally have those costs to factor in.
She says about 75% of that cost would have been hours worked by staff anyway. And even though the budget is tight, they do factor in scenarios where large chunks of money will be used on emergency responses.
Our budget is okay at this point, but yes, if we have multiple responses like that, it could be a problem. We do try to factor that into our budgeting, and we can try and do different projects or not do a project if we were to have to do another community response.
She says in all, it couldn't have gone more smoothly, and they're actually sharing their game plan with other health departments that might face similar challenges.
When you do these types of outbreaks, they're usually urgent, and you always learn from them, whether it's a new piece of equipment or a way to line people up or a streamlined form. And so we share among all of the health departments.
This was the only case of bacterial meningitis in Allen County last year. The last one was in 2012. Holly Campbell, News Channel 15.